representative of the Principal Secretary, the State Department for Livestock, and my good friend Mweke, the representative for the State Department of Environment, another good friend of mine, Ngeno, the DG for KNPHI, the ladies and gentlemen from Veterinary Services, Environment Ministry, SA, colleagues from government, academia, research, and organizations, the media, ladies and gentlemen, good afternoon. It's just 0.0 something past midday, so it is still good afternoon. On behalf of the Ministry of Health, I want to say that I warmly welcome you to this important multi-sectoral gathering. In fact, I have always joked with my team, and I keep telling them, I'm not supposed to be called chief guest. I'm supposed to be called host. But now, because my colleagues didn't come and they were the chief guests, I am standing in as the host and the chief guest. So today, as we launch these two critical tools for protecting our people, our animals, and our economy, the Rift Valley Fever Contingency Plan and the Human Brucellosis Testing Guidelines. Daktari, I have not heard what is the conclusion, what we should be telling our people. Because when I go to the village, I need to know. The other daktari here is telling me, in her village, wanaita ugonjwa ya maziwa. Sasa tutaendelea kusema kuna ugonjwa ya maziwa. That means we should stop taking milk, if we call it like that. So I think the next thing we should launch are the different names to be calling it. Otherwise, hiyo ugonjwa ya maziwa, it is not making sense. We keep saying, let the children take milk, you must take milk, it is good for your health, then we call it ugonjwa ya maziwa. Let me begin with why this matters. Rift Valley fever and brucellosis are among Kenya's top 5 priority zoonotic diseases. That is, diseases that pass between animal and people. They threaten the health of our families, the livelihoods of farmers and pastoralists, and equally the stability of economies. Because if you are unwell, if I was unwell today, I wouldn't be here. So destabilization, kama uyo mama, if that mama is not well, or she didn't go through the injections that she's talking about, then she wouldn't be here. And when livestock suffer, households suffer. When outbreaks occur, then markets slow, and movement is restricted, and income falls. It boils down to one thing: our economy. Our health, our economy. Therefore, we have seen this before. During the 2006-2007 Rift Valley fever outbreak, where 155 Kenyans lost their lives, and more than 50,000 animals died, and our nation lost an estimated of 2.1 billion shillings, about 32 million USD. And these numbers are not just for statistics and for records that we want to put on books. It is because they represent families, the families that are grieving. They represent children that are missing school. They represent communities that are struggling to recover. The contingency plan that we launched today is designed to change that story. And it gives us a One Health framework, bringing together human health, animal health, and environmental sectors together. We must detect the risk early. We must prepare effectively. We must respond quickly, and we must recover faster. So there must be also vaccines that are going to respond to the disease. And with better early warning systems, clearer roles for each sector, and stronger coordination from national to county level, then we can reduce the impact of Rift Valley outbreaks and protect lives and livelihoods. But Rift Valley fever is only part of the challenge, because we are talking about brucellosis again, which continues to weigh down and weigh heavily in our communities. And its prevalence varies widely, from 5% in highland areas to over 45% in some pastoralist communities. Therefore, ministry data shows that in 2021 and 2022, over 113,000 human cases were reported each year. And brucellosis is a debilitating disease. It causes long-lasting fever, night sweats, exhaustion, and severe joint and back pain. It can keep breadwinners away from work for days, and it can equally keep children away from school and for weeks or months. I think, Director Kamene, it is the high time you updated this data to 2025. We cannot keep talking about 2021. It's now 5 years. So I'm challenging everybody in this group. But the next time we are going to talk about brucellosis, we must have new data so that we can inform the country of the most accurate and recent information that is around us. The Ministry of Agriculture and Livestock Development, through the Zoonotic Disease Unit, they have joined hands with the Ministry of Health in the past, where we developed a national strategy to prevent and control brucellosis in human and animals. And a key challenge identified was misdiagnosis. Many rapid antibody tests used widely in facilities are sensitive but not specific. Therefore, it means they can produce too many false positives, and this leads to unnecessary treatment for some, missed diagnosis for others, and wasted resources. You see, if you're misdiagnosed, that means even psychologically you're not stable. Because either you're taking drugs which you are not supposed to be taking, you are actually cowed in your corner thinking that you're very sick, and maybe you're not. So this, of course, no guideline succeeds without supplies. Therefore, that is why we are emphasizing a reliable supply chain for RBT kits and reagents with proper monitoring to avoid stockouts and robust distribution system to reach facilities in every county. Accuracy in diagnosis begins with availability at the point of care. So are we connecting with the counties? I don't know where the COG is today. Are we coordinating? And do we have availability at the point of care? So ladies and gentlemen, these tools must not remain as documents. We must remove the decisions that we make from the table into action and ensure that these commitments to preparedness lead to preparedness, to evidence-based practice, and to partnership. First, when we talk about preparedness with Rift Valley Contingency Plan, we will strengthen surveillance, risk communication, and rapid response teams, especially during periods of heavy rains and flooding when Rift Valley fever risk is highest. Secondly, the quality of care. With the brucellosis guidelines, patients will receive the right tests, the right treatment, and better outcomes. And thirdly, with our partnership, none of this works without coordination across sectors and levels, that is national government, county government, communities, health, human resources for health, and livestock and environment. So this is one health action that must continually work together. I also want to speak directly to our communities. Prevention starts at home and in the marketplace. Boil your milk or choose pasteurized milk. Cook meat thoroughly. Use protection when handling animal blood, birth materials, or even during slaughter. And avoid eating meat from sick or dead animals. As we look forward to the festivities, this is going to happen a lot. And I was in my local church over the weekend. And I told them, during the festivities, so many things happen. You see some chicken is wobbling, and you say, hiya jagonjeka sana. Kamata. You know? You see a cow has, cannot even wake up in the morning, and you say, please bring a knife. Okoa. Mnaanza kujiokolea. So we want to urge the communities that this is not the time to eat meat from sick or dead animals. It is important to reduce the mosquito breeding areas by draining standing water and using nets and repellents where possible, and report sudden livestock deaths or abortion promptly to veterinary or public health officers. I am impressed with what is happening with the Ministry of Livestock and Environment, and especially with the vaccination program. I am hoping and wishing that all the animals in this country must be vaccinated, because that is the only way we can protect ourselves. I'm looking forward. Hata mimi ni mkulima mdogo, lakini pia ng'ombe zangu hapo itaendelea. Therefore, to our county teams and frontline workers, you are the backbone of this effort. I never finish my speech these days without talking to the frontline workers. Because we can do all these things. We can buy the equipment, build the infrastructure, have the commodities. But who is going to do the work? Must we not have a round of applause for the healthcare workers of this country? A round of applause. Because your vigilance in surveillance, your commitment to accurate testing, your timely reporting will make all the difference. And these new tools are designed to support you. Clearer guidance, better diagnostics, and stronger coordination. To our partners, we are grateful. We are grateful, and I wish to sincerely thank the International Livestock Research Institute and the University of Liverpool for funding and facilitating the development of these documents, and for their continued support in capacity building under the One Health approach. Your collaboration exemplifies the best of science, service, and solidarity. Sasa tumekwama hapo. And our vision is very clear that by 2040, the year 2040, we must prevent and control brucellosis effectively across Kenya, and to reduce the health and economic toll of Rift Valley fever outbreaks. With the plans we launched today, that vision is within reach if we all play our part. So let's move with urgency, with unity across all sectors, and with unwavering focus on the health and prosperity of every Kenyan household. Thank you, and God bless you all.
Four, 3, 2, 1, 0. A lot of love. Thank you very much. Okay, please now show the picture. Thank you. Now we have the contingency plan launched. Wajir County. Thank you. Wajir County, please. As they do that, PS Livestock Representative. Thank you very much, Madam PS, for